Welcome everyone. Dr. Kimberly Fodran, MD, has over 19 years of experience and her specialties include general practice and family medicine. She's a Los Angeles native and she rejoined the CSULB sports medicine team in 2015 after finishing her primary care sports medicine fellowship training at Kaiser Permanente Fontana Medical Center. We're lucky to tell you that she's a team physician for Long Beach State Athletics and is Chief of Medical Staff here at CSULB Student Health Services. She received her medical degree from Temple University School of Medicine and completed her residency in family medicine at Honor Health Medical Center in Scottsdale, Arizona. She's a member of the American Medical Society for Sports Medicine, American College of Sports Medicine, and the American Academy of Family Physicians. Welcome, Dr. Fodran, and thank you so much for keeping Cal State Long Beach safe from a medical point of view. We really appreciate all your work. I know we've all heard about the importance of wearing a mask in public. Can you just remind us from a medical point of view why wearing one is so important?
Absolutely, and thank you so much, Provost Jersky. So as we know, COVID is a respiratory virus spread by respiratory droplets. There is some evidence that perhaps there is some airborne transmission, but it is primarily respiratory. So wearing your mask really prevents the spread of these respiratory droplets to others. When you wear a mask, make sure that it covers both your nose and mouth. I've seen some people with it just covering your mouth. Sometimes it's just covered up over their nose. So do make sure that when you wear it, it covers both your mouth and your nose. Masks that have the exhalation vent, you might see that small circle on the mask. Those aren't currently recommended because they do allow aerosolized and viral particles to escape. And there is some limited evidence that's coming out that if you are exposed to someone and you're wearing a mask, that if you do contract COVID, that it is a lesser degree, it's less severe in terms of your disease.
So basically what I'm hearing you say is not only is there no downside about wearing a mask, but it's beneficial both to the wearer and to the people around the person who's wearing the mask.
Yeah.
That's great to know. We've been reading a lot and hearing a lot on the news about community transmission on college campuses, and there's a lot of talk about that. What does that mean, and how can we prevent it?
Yeah, great question. So community transmission basically just means that the virus is out and about. It means that people that are infected in a particular area include some that are not quite sure how they contracted the virus or who exposed them. So the way that we prevent this, as we just discussed, is wearing a mask, as well as physical distancing, staying home if you're sick, and please, if you are sick, do get tested, and avoid gatherings as much as possible.
Okay, so stay home, wear a mask, wash your hands, socially distance, and if you're sick, reach out and get help and get tested, and don't go out if you're feeling sick. Okay, I got that. Thank you. What specific things do you know of, and I know that you're in charge of this, but what preventative actions are we doing here at CSULB every day, every week, every month to prevent this terrible disease from affecting our community?
Yeah, so as you know, Cal State Long Beach has been doing a myriad of things. So on the physical building end, we have upgraded all of our air vents. We have instituted directional signage, limited the number of people in buildings and elevator spaces, really making sure that when you're here on campus, that you are physically separated from others as much as possible. We've also limited the number of, amount of people that we can have on campus to really reduce our level of exposure here on campus. In addition to, you guys all know to please complete the COVID pre-screen questionnaire before you come on campus. Got it.
Yeah, there certainly are lots of things and lots of ways that we're trying to keep us all safe, and thank you for for directing that, Dr. Fodran. So, I mean, you're a doctor and you know all kinds of things that we don't, but what surprising things or incorrect assumptions have we been making about COVID-19 so far?
Well, I wouldn't say you personally, but I think sometimes the perception is that COVID isn't a big deal. That if I get it, it's not a big deal. I'll just get a little bit sick if I get sick at all. But what we're finding is that there are a handful of, in addition to everything that we know, there are a handful of individuals who do have long-term effects secondary to COVID. They're called long haulers. And there are a handful of our campus community members who fall into this category that weeks to months after their COVID resolves officially, they have prolonged shortness of breath, they have prolonged fatigue, some people have joint pain, and people with more severe disease can end up with end organ damage. So heart, lungs, those types of things. So you really want to avoid this disease as much as possible.
Well, you're speaking for me there, Dr. Fodran. I certainly want to avoid it. And I think, you know, that's another thing that you mentioned that I really want to emphasize to our community, that we're not just doing this for ourselves, we're doing it for everyone else. So it's not just our friends, but our family, our grandparents, our parents, and people around us that we want to be and that we want to be safe.
Yeah.
And so this is really very helpful. So sort of bottom line, how many cases have we had since February, March here at Cal State Long Beach?
Yeah, it's a great question. So we've had 67 total campus affiliated cases. So not all of those are people that are directly on campus. As a matter of fact, the majority have not been on campus. Specific breakdowns, we've had 31 staff members who've been diagnosed with COVID and 36 students total.
And a sort of question for you, have you seen any students with really bad or tough symptoms?
We have had a student that was hospitalized for a couple of days.
Oh, no.
And there are stories, I have a couple of students whose significant others who are 18, 19, 20 who have been hospitalized in the ICU. So this is something to take quite seriously.
Right, and it kind of reflects something you said before, which is that we've all got to take it seriously. We've got to look out not only for ourselves, but for our parents, our grandparents, any immunocompromised people we may know or even not know. And so I guess if we're feeling sick, we should go and get tested.
Yeah, absolutely. If you're feeling sick, and even more importantly, if you were around someone who was sick or diagnosed with COVID. I know it's a little bit confusing with the recent change in CDC guidance, but LA County and the state of California is holding steady, and I would definitely recommend, please, if you're exposed to someone or around someone who's sick or even attended a large gathering, please get tested.
Well, I always take my information from a registered and qualified MD, and you qualify for that. So I'll take my advice from you, Dr. Fodran. Thank you.
Thank you, Provost Jersky.
So, I mean, given the alarming nature of COVID in Long Beach and California and the nation in general, it sounds like we're actually doing a pretty reasonable job about preventing the spread of COVID-19. As a doctor, can you give us any advice about what things we can be doing? How can I help as an individual or a person to stop the spread of COVID-19, other than, of course, the health measures that you talked about? Is there something I can talk about, something I can do?
Yeah, I would just encourage people as much as possible and encourage those around you to really adhere to those health measures. I know they seem very basic, but the actions that we take really influence those around us, and the actions that and the decisions that we make can definitely prevent disease and save lives and really impact our campus and Long Beach community.
You know, one of the things that this disease reminds me of a little bit is, I'm sure you know I'm a gay man, but in a few years ago with HIV, one of the things that we had to do was wear condoms. And it strikes me that in a way, COVID-19 is an easier ask, because a mask is much easier than wearing a condom. And yet, so many people changed their behavior and, were safe then. And we hope people are going to be safe now.
Yeah, I absolutely agree. There's a lot of parallels that are being drawn to our current COVID pandemic, to the early stages of HIV, and there's definitely so much left to be learned. But I agree, a mask is not a huge ask. It gets hot, it can be inconvenient, but what you're doing really is for the health and safety of our community.
Agreed. And we're all socially responsible, and we're doing our best. And, it's just like any other habit. If occasionally you slip and forget to wear a mask, don't knock yourself. Just go back and get a mask and wear one when you can. So wear a mask, wash your hands, socially distance. And it's a tough time we're all going through, but we can get through this together. So thanks, Dr. Fodran, for taking time out of what I know is an incredibly busy day to speak to us in our community. And go Beach.
Go Beach. Thank you so much for having me.